The first lecture is on the global water and sanitation status. Hi, this is Professor Anil Dutt Vyas. I am convener Bill and Melinda Gates programs working at the Manipal University, Jaipur. In this first lecture, I would like to appraise you on the global water and sanitation status. If you look at the global status, by 2015, 181 countries had achieved over 75% coverage with at least basic drinking water services. This is based on the UNICEF JMP 2017. Similarly, if you look to the sanitation coverage, 154 countries had achieved this target, and this is also UNICEF JMP 2017. In 2015, United Nations implemented 17 Sustainable Development Goals, and water and sanitation was also one of the big goals. And the goal for clean water and sanitation was designated as SDG 6. The water and sanitation SDG 6 certainly focuses on ensure availability and sustainable management of water and sanitation for all. The first target for that one is access to water. It says that by 2030, achieve universal and equitable access to safe and affordable drinking water for all. And this is the main target. The second is access to the sanitation. It says that by 2030, achieve access to adequate and equitable sanitation and hygiene for all and open defecation, paying special attention to the needs of women and girls and those vulnerable. In fact, those are the most severely affected. The third part of this SDG 6 is the water quality. It talks on the water quality. It says that by 2030, improve water quality by reducing pollution, eliminating dumping and minimizing release of hazardous chemicals and materials. That is, halving the proportion of untreated wastewater and substantially increasing recycling and safe reuse globally. The fourth point, it covers and says that about the water availability. By 2030, substantially increase water use efficiency across all sectors and ensure sustainable withdrawals and supply of fresh waters to address water scarcity and substantially reduce the number of people suffering from water scarcity. And this is also one of the biggest challenges. The fifth one, it talks about the water management. It says that by 2030, implement integrated water resources management at all levels, including through trans-boundary corporations as appropriate. Also, the sixth point talks on the water and environment. By 2020, protect and restore water-related ecosystems, including mountains, forests, wetlands, rivers, aquifers, and lakes. So this talks very substantially, very clearly on the various targets which has to be achieved by 2030 regarding the SDG 6. Now let us talk on key water and sanitation facts. If you look towards the water gaps across the globe, you will find that 844 million people, that is 1 in 9, lack access to the water. This is a big number. Almost 6 times the population of the United States lives without a household water connection. So still people are not with the connection. The water crisis is the number 5 global risk in terms of impact to the society. And that has been announced by the World Economic Forum in January 2018. 159 people depend on surface water, like a river, to meet their basic needs. When you say that surface water, the quality is compromised. If you look to the sanitation gaps across the globe, 2.3 billion people, or 1 in 3, lack access to a toilet. And this is a big challenge. Globally, 60% of the people do not have access to the safely managed sanitation. 892 million people, or 12% of the global population, defecate in the open. And this is also a big challenge for the developing nations. More people have a mobile phone than a toilet. And this is the fact also. Everybody has a mobile phone. Now let's talk on the impact of the health at global level due to the unsafe water and sanitation. The first is water, sanitation and hygiene related diseases which kills nearly 1 million people each year. 1 million is a big number. Every 2 minutes, a child dies from a water-related disease. And this is very alarming. 160 million children suffer from stunting and chronic malnutrition linked to the water and sanitation. Stunting means retardation of the growth. Diarrhea is one of the top 3 leading causes of child death, a majority of which are water related. The impact on women globally due to the unsafe water and sanitation is also one of the key concerns. The women and the children bear the primary responsibility for water collection. If you see in the developing nations, it's the women and children who bring all the water. Women and girls spend 200 million hours every day collecting water. And this is time not spent working, caring for family members or attending school. So it impacts the education system. Women and girls living without a toilet spend 262 million hours every day finding a place to go. This is also a big alarming number. Access to the improved sanitation leads to a reduction in assault and violence on women and girls. And this is the evidence-based fact also. Then we talk on the impact of unsafe water and sanitation on the global economy. If you look into that one, the reduction in time spent collecting water increases school attendance, especially for girls. And that is globally 1/3 of all schools lack access to basic water and sanitation. Having a sanitation solution at home means children are more likely to have high cognitive test scores, and this is also evidence-based score. For every year a girl strays in school, her income can increase by 15 to 25%. If you look on the economy, the impact on the economy due to unsafe water and sanitation, you will realize that $260 billion is lost globally each year due to lack of basic water and sanitation. Every $1 invested in water and sanitation provide a $4 economic return. Universal access to basic water and sanitation would result in $18.5 billion in economic benefits each year from avoided deaths alone. The impact on safe water and sanitation on finance is also very alarming. It will take 3 times more than what is currently being invested in achieve universal access to safely manage water and sanitation. Globally, to extend basic water and sanitation services will cost $28.4 billion per year. It's a big number. And $114 billion per year is needed to achieve safely managed water and sanitation, meeting the SDG 6 targets. This represents a gap of almost $90 billion. Access to credit plays a significant role in triggering household sanitation investments. People living in poverty are the most reliable paying customers when given the opportunity to access household water connections. Now, let us see what are the benefits of improving sanitation in the developing nations. Benefits of improved sanitation extend well beyond reducing the risk of diarrhea. This is number one issue. These include reducing the spread of intestinal worms, schistosomiasis, and trachoma, which are neglected tropical diseases that cause suffering for millions. Reducing the severity and impact of malnutrition. It also will promote dignity and boosting safety, particularly among women and girls, which are mostly deprived of that one. This will also promote school attendance of the girls. Girls' school attendance is particularly boosted by the provision of separate sanitary facilities and also potential recovery of water, renewable energy and nutrients from fecal waste. A WHO study in 2012 calculated that for every $1 invested in sanitation, there was a return of $5.50 in lower health costs, more productivity, and fewer premature deaths. In 90 countries, progress towards basic sanitation is too slow meaning they will reach universal coverage by 2030. Finally, I would like to emphasize what are the key challenges in overcoming in sanitation progress across the developing nations. In 2030, the UN Deputy Secretary General issued a call to action on sanitation that included the elimination of open defecation by 2025. It also emphasized on achieving universal access to a basic drinking water source appears within reach, but universal access to basic sanitation will require additional efforts. The situation of the urban poor is also very alarming, poses a growing challenges as they live increasingly in megacities, where sewerage is precarious or non-existent and space for toilets and removal of waste is at a premium. They have to pay more price, they have to pay more cost for that one. Inequalities in access are compounded when sewage removed from wealthier households is discharged into storm drains, waterways or landfills, polluting poor residential areas. So the cost the poor are paying because of the wealthier families. Limited data available on this topic suggests that a large proportion of wastewater in developing countries is discharged, partially treated or untreated directly into rivers, lakes or the ocean. Wastewater is certainly increasing, seen as a resource providing reliable water and nutrients for food production to feed growing urban populations also. Yet this requires management practices that ensure wastewater is sufficiently treated and safely used. Institutional oversights and regulations and public education campaigns to inform people about wastewater use is also very important. Hope to see you again in our next lecture. Had a great day. Ciao.